So we're going to go ahead and bring on our first guest, Dr. McCain. I am very excited to have her.
Good morning. How are we doing?
I'm good. I'm good. I recognize that office.
Yeah, it looks familiar, right?
So tell us, first of all, a little bit about you and how you came to have the very unique practice that you do.
Right. So I'm actually born and raised in Fort Pierce. I studied locally, and then I went to medical school abroad. Actually, we studied in Grenada, so 2 years there. Then I had 2 years in New York, 2 years in Miami. I did family medicine residency in Jacksonville. So I've actually been able to see kind of different healthcare systems, the way that we operate in different states. And it's really eye-opening to see that there is a lot of dichotomy in the way that we practice just based on locality. So that's kind of one interesting point. And then, so the kind of clinic you're referring to is called a direct primary care clinic. It's unique to our area and actually somewhat unique still to Florida because it only became legal in 2018 when the insurance companies were overruled that we could open up these types of practices. So it's kind of a crazy concept that we were not allowed to practice direct primary care. Although it's been around in the U.S., for the past decade, there's been doctors practicing for the past decade, but still some states don't allow it. So basically, right, because insurance companies don't want us to. Basically, what direct primary care is, that we are actually working with the patient. We don't have that middleman that tells us how we need to practice, and really kind of all that red tape that gets in between you and the doctor and the patient relationship.
And I can vouch for that. So I've become a patient of yours, right? I was introduced to your practice by a third party and came in, checked it out. I've never, and by the way, guys, if you haven't watched the show a lot, I have more medical conditions. Like I literally one time had an Aflac representative call me because they thought I was 70 or 80 years old and they had my age wrong. So I've spent a lot of time in doctors' offices, and not just for myself, but for family members as well. And I've never experienced anything like your practice. And I mean that in a very positive way. So when you walk in, you're welcome. They ask, do you want something to drink? It's very calm. There's maybe one other patient in there because you guys really run on time. I've never seen a doctor's office that is so prompt in my entire life. That's so unique. And then when you come in, there's a conversation about what's going on with you and how you're feeling about that and kind of putting the pieces of the puzzle together. And it's a very interesting. I have your cell phone. I don't know anybody else who has their doctor's cell phone.
Yeah, there's a lot of perks that come with being a member of our patient. But again, it goes back to explaining that the reason why we can do all of these things is because we broke the mold. And it's just so simple. We just use common sense. You hire us and you pay us directly. That's it. That's really all. So it's like a gym membership. It's like Netflix. And when we become affordable, then people can start prioritizing healthcare. There's no reason why 25% of people are scared to go to the doctor's office because every time they go, they have to pay a copay. So now they're like limiting number of visits. It doesn't work that way at direct primary care because we don't have the overhead of needing to seek reimbursement from insurance companies who honestly don't pay doctors is what we like. Society doesn't really realize that doctors have to go through. We're all burnt out in this system. It's not just patients burnt out with the 7-minute visits. We're burnt out with that 7-minute visit, requirements to discuss, hey, are you smoking? Even though I asked you every single visit, it's a required thing that they have to ask or they don't get reimbursed and paid for it. So when that's the focus of every visit, it becomes really quick and personal. They have to double book, triple book patients and seeing 30 patients. So basically, the direct primary care allows us to cap the number of patients, whatever we feel comfortable with. So I'm never going to see more than 600 patients in my panel versus at primary care in the fee-for-service world where we're talking about with insurance, that's what they call it. Primary doctors have 3,500 patients in their panel. And it's just almost like, feels like a factory.
So sorry, I get fascinated by this stuff. So when you're taking care of these people, do you have other patients that talk to you about what a difference this is making in their health and in their life.
100%. I think even that first visit, like you mentioned, where it's we're really having more time to talk. So, you know, our visits are like 30 minutes to an hour. That's the way we schedule and block them. And the truth is, when we have more time to really get into the history, you know, mental health plays into physical health. We need to ask specific questions. We need to know the dynamics. What's the safety at your home? Are you missing some parts of your wellness? Like, you know, who wants to really pay a doctor to talk about wellness? But I kind of force my patients to have that wellness visit at least once a year, because I uncover a lot of things. And men in particular, maybe they don't open up about their sexuality or things like that, but this is life. This is part of health, and it's important to be comfortable with your physician. But you only get there through developing an actual relationship with them. And that's what direct primary care allows, because of the actual model that we have established.
So, I mean, so it's not available to everyone. You covered that. It's not everywhere.
It's not for it's not for everybody either, but
for everyone. Yeah, it's not. And for instance, I have a friend who said, you know, well, I have literally no health conditions, and at least she knows of. And you know, and I don't go to the doctor that much. So I'm just not sure if it's the right fit. That kind of thing.
Yeah, but here's the funny thing is that sometimes when we're actually talking about things, it comes up. Oh, did you know that you probably should do these things given your age group, or, you know, be more proactive with health? We wouldn't be saving all of our medical issues to the day we're in a hospital and we're like really sick and then trying to play catch up. We can be more proactive. The other thing too is, I mean, we're available as needed. I mean, if something really happens after hours or on the weekend, like you cut yourself, I mean, I don't want you to go to an urgent care. I'm a family physician. I'm direct general primary care. I can sew you up. I can cut out abscesses. I can do procedures in office. It's just, it tends to, again, in that factory style of medicine, that you get referred out. Oh, it's the weekend. Go see urgent care. You can't reach your physician. And again, because we have less patients, we're able to be more personal, more accessible, and more technology too.
Yes. Oh my gosh. Yes. And you guys have access to specialists, all that kind of thing. And we had a comment that says, I worked in a hospital for 6 years. Billing is an eye opener, especially Medicare, Medicaid. And it's crazy. So I've been around hospitals and doctors' offices also from the other side of it, because of what my mother does for a living. And then also because I've had friends that did it. And I've had friends that actually worked in medical billing. And when you look at some of those invoices, you go, that doesn't cost that much. I have seen a box of Kleenex billed at $45.
It's amazing. So that's another thing I love about our clinic, is finding resources for patients who need to be mindful. We are responsible for financial health in a way, you know, medical health and financial health sometimes go hand in hand, and we should be very knowledgeable. In insurance world, like if you go get your blood work done and you ask us, how much is that going to cost? I have no idea. You might get that bill 6 months later, and then you get the sticker shock 6 months later, right?
So when you're looking at this, when you're looking at this as a whole, because I know that this is a super passionate subject for you. So when a patient is looking at, you know, I have these, you know, all these expenses, and I have these medical conditions, and I need help. And let's say that DPC is not, direct primary care is not available to them. What are some things that they can do to seek help and to get more information, to be more educated, and make sure that they're not getting ripped off and that they're getting the best possible options?
Oh, you're talking about like, so if they're not with direct primary care, but they're going to, you know, a general fee-for-service type of clinic? Oh, you have to be your own advocate. You really have to know if you're really dependent on that insurance, which here's a fun statistic, 20% of people never even hit that deductible. So why are we all trying to pay for that deductible every year? Like it's some prize at the end of the year if you meet that deductible. But you have to know your plans. These plans are so confusing, and you really need to know what's covered, what's not covered. You know, really just try to, it's hard. It's hard.
And a lot of insurance agencies are sneaky when they sign you up, and they don't tell you everything, and they kind of put stuff in small print. I recommend to any viewer out there, get you a good health insurance agent if you need health insurance, to really sit down, that understands the plans, that will go through them, that will get to know you and understand what you actually need and match you to a correct plan. And if you would like help with that, I actually know some wonderful agents. Feel free to reach out to me after the show, and I will make a connection for you, because that's so important. You need people that are going to give you the full detail, that are going to give you the rundown. And if you don't understand insurance, if it's just something that goes whoosh, like it does for most people, if you don't just live in it, right? there are some wonderful, again, outside of agents that really care, there are some wonderful resources that can help you. Reach out to me after the show. I will be glad.
And Kathy, I sent you a list, I think, of some agents that we have vetted, because again, a lot of people were just so trained that we need this card, we need this insurance card. You go to the front desk, they ask for any updates in your insurance. There's options outside of insurance. Insurance is heck of expensive, right?
Yes,
and it's premiums and deductibles and copays. Well, there's options outside of that. Primary care, if we have the time and resources dedicated like we do at our clinic, we can cover 80% of your medical needs. You don't need insurance for 80% of your medical needs. It's that 20%, seeing specialists, big ticket studies, going to the hospital. That's when you need some sort of background coverage. But it's not just about commercial insurance. That's very politicized. There's health shares, catastrophic plans, wraparound plans. I mean, our family did the same.
Interesting. So it's kind of like insurance, like how it works. And I know so for instance, so the partner that you guys have for that would cover ER visits, things like that. If I partner that with what I am paying you guys for my premium, which is super affordable, by the way, guys. Again, if you want information, contact us after the show. It's still half the cost of what it would cost me to go get this big insurance. And I don't have deductibles and I don't have all this nonsense. And it's really, really interesting when you go and you start researching these things and you start digging in and seeing these other options, and people aren't educated. Why? Because insurance companies are the ones with the big bucks that throw all that money into marketing, and a
lot of insurance brokers we have found specifically locally, since DPC is kind of a new concept in these wraparound plans and health shares. Again, health share is not legal all the time until more recently. A lot of health insurance agents, they get commission for selling insurance plans, so they may not know what health shares are, but Sedera, Zion, and then there's like Christian-based and MediShare and faith-based ones as well. But I mean, like, I stand by it. It makes sense. Our family went from United Health to a health share, and we're saving 50%, which we put back into mental health for us. So,
which I'm sure you need as a doctor.
Right. Everyone needs a little bit of an outlet. Right. So we just, we're able to, have more family outings and enjoy more activities and things like that.
Yeah. And what about things, because I know this question is going to come up at some point. So what about things like vision and dental and solutions like that? Do you still recommend more traditional plans for that, or are there DPC type programs?
So we're at that stage with the DPC network. So again, this is such a growing movement that everyone is starting to collaborate. There's now going to be there's an organization forming for specialty groups. So if you need surgery, for example, there are direct specialty surgeons, that actually will give you cost up front, know what to expect with your surgery, all inclusive. Like there's a GI doctor that does colonoscopies and EGDs and walk in to walk out with pathology included for $750, like in Orlando. Like he's the only, versus you don't know what you're going to be spending. You're going to be spending your deductible, right?
Right. And then plus some. And people don't realize that, because things like anesthesiologists can be billed separately. Right.
And facility fees and pathologies, and it adds up quickly. But for what we've done for our patients is, if we know we need an imaging service and someone doesn't have insurance, but again, health shares may cover that. They have to pay up front, but they'll get reimbursed themselves. It's the patient doing their own paperwork, really. So we've asked all local radiology companies, hey, submit your best prices, and we have an Excel sheet. So depending on what study you need, you may be shuffled to a specific radiology center. And we have the same thing for vision. We know where we can get cheap eye exams, or the cheapest eye exams locally, dental care. There's IRSC, dental school. They need participants, right? So you can get dental cleanings there for discount. As long as you have time and, to ask your physician for these resources, there you go. We are always seeking resources.
I think that's it. And I think more physicians should have these resources on tap. They really should. Now, my mother, who lives in Waco, Texas, and I'm in South Florida, just in case anybody that's watching doesn't know, her primary care physician, who takes regular insurance and all that type of thing, he's really good about this kind of stuff like you are. He's been around our family for about 20 years, and he's really good about finding those right resources and spending time and taking time. But that's very unusual. Yeah. But he still does it, and he has those resources. So if you're with a doctor and they say, I don't know, go look it up yourself, or they say, well, this is just who we always send people to, and there's no alternative, there's no reasoning behind it, they're just in the same network, question that, guys. You're allowed to question doctors.
But don't question your doctor too much, because here's the thing, it's not our fault too, you know? No. Like the reason why I almost actually retired way earlier in my career, I was getting physician burnout. Physician burnout is real. We are unhappy with the system just as much as patients are. So much to physician suicide is actually like the #1 profession that has suicide, because it can be pretty unrewarding when it comes to dealing with the insurance companies and the frustrations. I felt myself saying, sorry, I'm running late. Sorry, I don't have this. Sorry, you have to talk to 10 people before you get to me. And I don't know where in this paperwork process you are. It's not on my, I mean, the job of a physician has to get broken up so much that I'm not in charge of referrals in these other clinics. If you're with me in my office, I might say, hold on, let's stop the visit. I'm going to do my own referral. I'll send you the paperwork fax right now. Guaranteed fax was sent. Done. Right. But in regular world, it is. It is. It's very difficult. It is. But I want to also encourage people, if you need something and your needs not being met, look elsewhere. That's okay to do. And that's why a lot of clinics are starting to include like case managers into their practices. So like at federally qualified centers, they have case management. It's really hard to run these businesses when you're really dependent on the insurance company getting in between the relationship. So that's
it is. And insurance companies, I have so many.
They're really important though. So that's the other thing is a lot of patients, I would say my panel is actually 50% insured and 50% uninsured. And I would tell everybody that comes in, I actually want you to be insured, because I can't handle 20% of your medical needs. And for that, you need some sort of coverage, whether it's a health share or insurance. So I actually want all my patients to have insurance. You just don't need it for primary care needs, not in this not in my situation.
Right, exactly. And there are plans designed mostly for that 20%, you know, that's going to be just for the really big stuff, not so much for the little stuff. You don't really need to worry about that.
But I'll tell you, even our patients who have insurance, when we draw our own labs here, we have discounted network pricing for the DPC networks that we're part of, and they're like really impressive pricing. Most of our labs are like $3 and $4, $2 for an A1C, for example. So a lot of our patients. I know. A lot of our patients who have insurance, what they'll do is we'll give them option. Do you want us to process it through insurance? And some of them will start out in our clinic saying, yeah, because I have insurance, might as well use it. But if your labs are only covered by 80% with your insurance and it's a $300 vitamin D, it's going to be more expensive than, hey, I would have charged you, $15 for your vitamin D. That's one of my most expensive labs I have. So a lot of our patients start with using their insurance, and then they end up saying, well, what's the cash price? Oh, 17 labs for $120. I'll go with you guys.
Yeah, right. It's just way more simple.
Yeah, and same thing with medicines too. Yeah, same thing with medicines, because we get our prescriptions direct from the wholesaler, like from the pharmaceutical companies in a way. We can offer really discounted medicines. I really have not found many instances where GoodRx beats our cash rates. So this is again another benefit that our members have.
Which is wonderful. And I think too that the upfront pricing, which I'm big
transparency.
Fan.
It's really important.
Transparency, yes, it is. And I've always been a very big fan working in large corporations for there to be something like Aflac to kind of balance it out, because companies like that, and it doesn't have to be Aflac per se, but they're just kind of the biggest example out there. Yeah. And what they do is they pay you, and so the patient, and so when there's something like, lab work that needs to be done and stuff like that, you file a claim with them. And this insurance is super cheap, guys, by the way. It is super, super cheap. It's usually
one of the ones we recommend too.
Yeah, I love them, because then, if you have a kind of more expensive doctor's visit or a more expensive test, they pay you, and that helps, either completely covers it in some cases, or it helps offset the cost a little bit. And it really, really helps out. It does. I've used them several times. I've brought them into companies. Huge fan of these little alternative benefits. And so what I do, and I've known some other people that have pieced these things together as well, is I use the DPC. I have, like an Aflac type solution. And then I'm looking into the different, I'm just blanked out what are they called? The shares.
The health shares? Yeah.
Health shares. Yes. The health shares. And that's going to be my other 20% coverage right there. And again, when I priced it out, half the cost of insurance that would have been less good than the coverage I'm getting.
Right. Insurance, and that's one thing I think that the movement is trying to really emphasize. Having insurance doesn't necessarily mean access to care. Yeah, you have insurance, but Does it still take you 3 months to get into the doctor because you're only allowed to see specific doctors? Like you don't really have choice sometimes of where you go, who you see. There's just so many limitations. Prior authorizations needed. Medicare rolled out as of last January that if I want to get a CT study, because I think someone has a lung clot in their lungs, I got to get on the phone and get a prior authorization from Medicare. That's like a 3-hour process of my time just getting sucked away in a phone cycle. Those type of who's ever making those decisions, that's life and death decisions that are really becoming a problem. Yes,
they are. And it's gotten ridiculous. And I think that's where I get really frustrated with the insurance side of it, and including Medicaid and Medicare, which are government run, and that it's gotten so cumbersome. And I've watched cancer patients have to spend days, literally days, and I mean 7 to 8 hours in those days just to set up treatments, just to make sure they're getting through to the right person. That is insane. That is insane.
Last year, Medicaid rolled out this document that was like supposed to simplify healthcare. It was 2,700 pages long. I simplify healthcare. I can do it in a trifold brochure.
Right. Yeah. I don't understand why it's being so complicated, and it's causing, like you said, it's real life or death decisions. These people are complicating, whether it's politicians or people at the insurance companies, they are complicating issues that trickle down and cause people pain, cause people illness, cause people, in some cases, death, because it's just too complicated. We had a comment, you should try the VA. Yeah. Trust me, I know.
My dad loves the VA. He goes down to West Palm. He loves it. I guess there's pros and cons to everything, right?
I think it's the location too. I think it's the location, because I know, like down in Miami, there were a lot of problems with the VA, and I know that certain DFW locations are not that great, but then other ones are great. So it just kind of, I think some of it's that, but then also the bureaucracy though is
right.
That's super special. That's all.
Yeah, and again, it's in those type of facilities. I know a lot of colleagues that go to FQHCs or work at the VA because they get loan forgiveness. But they have such high turnover, and then you're seeing a new doctor every time. And that's, again, problem with creating that relationship. And then things get lost to follow up. That's very dangerous. One thing I do for all our patients that come in, like we do massive records requests. I go through them with a fine tooth comb. And there's been times where I said, 2 years ago, you had a CT scan. It said you had a lung mass. Did anybody do anything? I didn't know that. Nobody told me that. Oh, yeah. Let's follow up on that one then. Let's just see what that one's about. And so often I catch things that someone went to the ER for a car accident, and then they still have back pain. I was like, all right, let's get those records from the ER. Turns out they had a kidney stone. They went tell you, no, because you're not there for the kidney stone. You're there for the car accident, right?
Which is so dumb. Like,
maybe they told you about it, but you're in that situation of high adrenaline because you just had an accident, right? So you really need someone as a patient advocate. When my patients end up in the hospital, I'm following along. I've got, their system logged into my computer system. I'm saying, hey, it looks like you're about to get discharged. Just, make sure you're asking these questions, here's what you have. Here's what it looks like you have planned. Oh, maybe this is a medicine that you stopped taking. Remember to tell them that.
I am the queen of questions when I am relatively well. Like I have to be at least, functioning brain wise. And then, and if it's a loved one, but I did have a situation where I went into the emergency room and I had a long seizure and I was out of it. I did not ask questions because my brain was funky. And when I was discharged, everything was wrong. And I had not seen the same doctor once. I had not seen the same nurse more than once. And I literally had like 5 or 6 different people walk in and out of my room and never come back. And so everything was wrong that was notated.
It's disorienting.
Yeah. And so you have to, it is good, like you said, to have that advocate that steps in and goes, hey, don't forget, do this. This will be helpful. This will be good.
And follow-up's important.
It is. It's very, very important. So just to because we're kind of coming to the end of your little segment here. I know it flies, right?
It does.
So, the alternative benefits, look into things like DPC, direct primary care, look into things like the shared health options as opposed to a traditional insurance. Look at Aflac, who has dental, vision, life, everything else is super inexpensive and will pay you. the patient, which is really, really nice. What other suggestions do you have along those lines for people that are kind of the
don't forget about wellness. Don't go to your doctor just because you have a problem. Maybe make those appointments to talk about what can I do to maintain health. I think that's, the American society that we don't really do that. We know that we probably should, exercise more and eat more, but there's also, things that, just checking vitamin levels or, what is your nutrition, and talk to them about weight loss. Things there's so many times that people were like, hey, I didn't want to bring up, it just seems like a little minor thing. And I'm like, well, let's talk about it. Did you know there's actually a fix for incontinence, young ladies, women out there? And people are just embarrassed to talk about it, or they just think they got to live with it. You don't. I mean, just at least ask. Yeah, at least ask your physicians about, is there something out there? And think about second opinions if necessary. We have a second opinion. We've got Rubicon. So that's another benefit of our clinic. That's
probably second opinions. I'm a huge fan of them. Okay, so we have a question for you. Fascinating conversation. DPC makes such great sense. Do you offer pricing for families? And would it be beneficial for a Medicare recipient?
Okay, so our pricing is done on it's like a monthly membership, and it's based on age groups. We don't have something specific for families right now. We see adolescents and up, so 13 years old and up. In the future, thinking about adding pediatrics, 2021, we're actually going to be adding mental health to our clinic. Like a counselor. So that's our goals. Medicare patients can benefit. Sometimes people are paying extra for these supplemental plans, extra for their prescription pharmacy benefits. Look at our pricing. Sometimes when people look at our medicines and they realize that they save so much money on our prescriptions, that pays for their plans. So that would be it. And then as we age too, don't forget the chances of ending up in the hospital, for example, or needing an advocate, needing a specialist. Sometimes you need just a little bit more attention, more care, someone to slow down and explain things. It's a foreign language. I mean, I think that gets even more important as we age and we head into the Medicare population.
100%. And guys, just so that you know, just to kind of recap what she said. So they do have options for all different ages of people, as long as it's 13 and up. Check them out. I can tell you from personal experience and lots of price comparison that it is a very affordable option. It's a wonderful.
Listen, our prices go from 13 starting at $49 a month. Over the age of 65 is over the age of 60 is $129 a month. And these prices actually are not concierge prices. I'm not a concierge physician. I want to maintain that kind of degree of separation because we want to be affordable for the average person. We do have pricings for employers. So businesses who can't afford health benefits, maybe you even have a part-time employee you really like, you want to keep, but you don't have the hours to provide them health benefits. This is an option. What we do is we pretty much just average the age of all your employees, and we provide a single rate.
Almost like an insurance would.
So we have plans for businesses, for example, so we can have health benefits offered, and people get back to work. So they get sick, they get seen the next day, they get back to work.
And exactly. And that's why these things are so important. Thank you so very much for joining us today.
Thank you, Ms. Catherine.
Tell people real quick how to get hold of you if they would like to reach out.
Probably the easiest way is even just looking us up online, Southern Comfort Health, Direct Primary Care. Our website, SOCO, SOCO Health, DPC.com.
Yep. And again, I will restate this information at the end of the show, but thank you again so very much for joining us. It was a true pleasure. I really enjoyed it.
Thank you. Yeah. And I'm looking forward to hearing what Jennifer has to say.
Absolutely. In fact,